My name is Abigail. I'm the host of the Cradle To Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle To Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle To Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned. My name is Abigail. I'm the host of the Cradle To Crayon Show.
We are back here again. It's a Cradle To Crayon Show right here on Sunny 88.7 FM. We're also live on Sunny TV. Also our Facebook page is Cradle To Crayon Facebook page, also Sunny FM Facebook page, and also on our socials. Get on your Google Play, the app, download Sunny TV app, and then you get it. You can be able to watch it on your phone, on the move, whatever it is that you are, you can watch it. This morning, I have here my midwife, my favorite midwife. I want to talk about amniotic fluid complications with amniotic fluid. I want to first of all find out what this is. Once amniotic fluid comes to mind, we know we are talking about pregnancy, and with pregnancy, Rahel is here to answer all our questions. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. But before we get down to it, let's take a break. We'll be back.
In the heart of our community, a radiant symbol of hope shines bright. The Cradle To Crayon Foundation, in collaboration with Honorable Alfred Vanderpoy, MP for Ablekuma South constituency, warmly invites you to the 7th edition of the Worm Free Child Project. The Worm Free Child Project is deworming 1,500 children between the ages of 3 to 13 years, sensitize and educate them about the dangers of worm infestation, and extend a caring hand to address other ailments they may face. Date is Saturday, 15th November 2025 at Mamprobi Girls School, 8 a.m. sharp. This edition is sponsored by Yum Vita, Jacora Ventures, Linked Medical Services, Kester Cakes and Pastries, Sankofa Foods, X Natural Mineral Water, Kivo Gary, Eddie's Pizza, Mr. Yogurt, Cleanol Wipes, Cocoa Dairy Free Milk, Transnational Insurance Brokers Limited, Alisa Hotels, Oro Insecticide Spray, Cracks, Don Simon, Fairway Supermarket, Pasquale Yogurt, Baker's Biscuit, Prom's French Milk, Voltic Natural Mineral Water, Rohi Children's Clinic, Pediatric Society of Ghana, JH Health Connect, Amponsai Pharmaceuticals, MG Pharmaceuticals, Panacea Pharmaceuticals, Danex Artin Stowin Pharma, Tridem Pharma, Bedita Pharmaceuticals, East Cantonment Pharmacy, Phytorika Pharmaceuticals, Shalina Healthcare Ghana. Media partners are Sunny FM and Sunny TV. This project is powered by My Life Insurance and Wembat 400. For further inquiries, please call 0554 000 155. That is 0554 000 155. Come and be a part of something truly meaningful. Worm Free Child Project. Your change can change lives.
Lift up your spirit at 88.7 FM.
Praise the Lord, all nations.
What is happening? Yeah, welcome back. It's a Cradle To Crayon Show right here on Sunny 88.7 FM, also on Sunny TV. I'm excited to announce you the 7th edition of the Worm Free Child Project. It is back. It is happening live. Mark your calendars. We are doing this in collaboration with the MP for Ablekuma South constituency, Honorable Oko Vanderpoy. We are deworming 2,000 children between the ages of 3 to 13 years. The agenda is to sensitize and educate them on the dangers of worm infestation. Also want to extend a caring hand to address other ailments they may face. Our pediatricians are going to be on site. We are going to talk to the children. They are going to screen them. We are going to have a lot of medications. Whatever it is that they need to attend to, they will do that. It's on Saturday, the 15th of November, 2023 at Mamprobi Girls School, 8 a.m. sharp. Want to say thank you to our sponsor. They've been amazing for the support, for all the things that they have done and what they are continuing doing so far. We say thank you to Yamvita, Jacora Ventures, Lynch Medical Services, to Kester Cakes and Pastries, to Sankofa Foods, Ex-Natural Mineral Water, Kivo Foods, Eddie's Pizza, Mr. Yogurt, Clenel Wipes, Coco Dairy Free, Transnational Insurance Brokers Limited, to Alisa Hotels, Oro Insecticide Spray, Cracks, Don Simon, Fairway Supermarket, Pascal Yogurt, Baker's Biscuits, Proms French Milk, Voltec Natural Mineral Water, Chicken Inn, Rohi Children's Clinic, Pediatric Society of Ghana, JH Health Connect, MNJ Pharmaceuticals, Panacea Pharmaceuticals, Bedita Pharmaceuticals, East Cantonment Pharmacy, Phytoraka Pharmaceuticals, Danes Item Starwind Pharma, Trident Pharma, and also to Shalina Healthcare Ghana. We say thank you to our media sponsor, to Sunny FM, also to Sunny TV. This project is made possible by My Life Insurance and Wembat 400. For any further inquiry, whatever it is, we want clean clothing to give to the children, shoes, toys, whatever it is that your kids are no longer using them. Just call the number. We'll be glad to have them, also to give it to those who are in need of them. The number is 0554 000 155. Come and be a part of something truly amazing. Now to our sponsor, we say Back Specialist Hospital Fertility Center, your number one center for all fertility, maternal, and general health concerns. That services include IVF, IU, and other fertility services. There's child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care. There's inpatient care, surgical service, that with general surgery and plastic surgery. There's theater services, and of course, laboratory and ultrasound scan service. Locate Back Specialist Hospital Fertility Center right here in Accra. They are in Taifa, or call them on 0558 862 292 or 0592 196 003. Back Specialist Hospital Fertility Center, integrity and excellence in health care. We are live on Sunny TV, also on our Facebook page, Cradle To Crayon Facebook page, and also Sunny FM Facebook page. We are live there, join our discussion. Also on our socials, download the Sunny TV GH app on the Google Play Store, and then you can also join on the go, wherever you are, you can join in the discussion. My guest is Mrs. Rachel Hesimati, midwife from Greater Accra Regional Hospital. Rachel, good morning. Good morning. It's good to have you back here as usual. Yes. So, amniotic fluid complications. In the first place, what's amniotic fluid?
Right, so amniotic fluid, like the word says fluid, so what comes in mind is liquid or water in a layman's term. So when one gets pregnant, right from day one going, when you get pregnant, a fluid start forming even before the baby starts to grow and start to pee, to increase the fluid. This fluid start forming in the womb, and it serves as a protection, a cushion that protects the baby. So it's like a pool of water, allow me use that plain terms, where the baby feels comfortable in, with the right or constant temperature that the baby needs during the period of pregnancy till you get to term. So this is something that grows with the pregnancy and ends with the pregnancy. So it's very important during the journey of pregnancy. One may ask that amniotic fluid, without it, can't the baby form because it's just fluid? No. The baby needs that for development. Muscles, bone, everything, even the digestive system, how to swallow, and it's the fluid they swallow and they bring out, even practice how to suck and all that is the fluid. The fluid serve as a shock absorber. When they are in there, it serves as a protection of infection.
So shock absorber, that's if the woman happens to fall down,
or if a severe hit on the abdomen or something. This is there to protect,
to cushion them,
protect the baby against any trauma, if I'll put it that way. So you can imagine if this is not there, how would baby grow? Or if it's there and it's not enough, how will baby grow? If it's there and it's excess, what will happen to the baby? So it's very important we talk about amniotic fluid. And some people will get to the complication, but when they are pregnant, they see leaking out. Some is fluid it's very important to rush. That is why we tell our pregnant women, when your water breaks, don't sit at home. Come to the hospital. The same way when you see it leaking out, you don't sit at home. You come to the hospital. Because when you are not term yet, and you are losing this or what is protecting your baby, what is cushioning the baby, what the baby is helping the baby to develop, you are losing it. It tells you what is going to happen. That is either you fall into labor pretermly or something will happen to the babies. Affect the cord. We'll get to the complications where the cord can be compressed, and the cord is what is providing baby with nutrients and oxygen. So imagine it being compressed, then the baby is deprived of oxygen, baby is deprived of nutrients as well, and the development is at stake here. Yes.
Okay. So you're talking about fluid. Yeah. So it means it's colorless, just like water.
It's
ideally, that's a color it should take.
As the pregnancy gets or advances, or when they come into labor, we expecting clear fluid, but sometimes the baby poop into the water or the first fluid, first poop, which is green, amniotic fluid, meconium. Yes, we don't. Meconium, if it happens, as if baby aspirates, is also another issue on its own. And the normal circumstance, we expect that it should be clear, because each and every time it's been washed, the baby swallow in and out, it should be clear. But when you come in, there is a little greenish, yes, it's expected, but we don't expect too much of the poop in there. Usually those happen during labor and
the
at
tail
the end of
when it's
pregnancy.
about delivering.
But those who get it leak out will tell you that since you are clear,
Okay.
When you notice clear with blood stain, that is also another issue. Is it that your placenta is separating and you are bleeding, and the liquor is also coming out? We have to look into it. It's an emergency. You need to come to the hospital right away for we to attend to you.
Okay. Now let's go at the complications that can arise with this.
Everything is extreme and low or limits, if I'll put it that way. So we have something we call oligohydramnios and then the polyhydramnios. So oligo is just a less amount of the required amount of fluid. So one may ask, as you growing, before the pregnancy is growing, by 34 weeks, we expect about 800 mils of fluid around the baby. And as you get to term, it reduces gradually because baby is swallowing, baby is making good use of it. So it comes as low as 600, 650 thereabouts. But anything less than that, anything more, let's stick to the oligo. That is less.
That's a less of it.
Then there is a problem.
Less than the 800 mil.
Less than the 600.
600.
When you are getting to term or in the mid of your pregnancy where you are getting less than 400, 500, then there is an issue here. I had a picture that I don't know if we can put, where we see the oligohydramnios around a baby, and you see the amount of the required amount around the baby. The two different pictures, how the baby is looking in there.
Before we get, I want to find out how is it assessed. So let's say in the normal state, I said that it should be 800.
Yeah.
Is it something that you assess on daily visits?
Yes, so it's a scan.
It's a scan.
Yes, on a scan you do your scan.
At a point, you require that they do the scan to know the amount, the volumes of the water.
And then also a midwife can also detect that as you are advancing in pregnancy, baby is growing, and we expect we measure the abdomen when they come for antenatal. They call the symphysis, to find out height. It tells us at least you should tally with your gestational age or the weeks and pregnancy. Now you are almost 9 months, and when you come, we are measuring less than the weeks we are calculating. We need to look into it. What could be the cause? Is it that your baby is extremely small for date, or the liquor around the baby is not enough? So quickly your health practitioner or your midwife doctor will request for a scan. That is where the calculation or the measurement is done. It will be assessed to say, ascertain whether you are overboard, you are within, or you are less. So it's the scan, ultrasound scan, that picks that up for us.
Okay. So coming to the oligo,
less amount of the fluid around the baby. And like I said earlier, is this fluid that the baby is swimming, and they feel comfortable, they're able to stretch out their bones and exercise their muscle, roll over, have all the chemicals in there. But this time around, having small amounts, this baby is restricted.
They can't move as much as they are supposed
so
to.
So developmental problems
Okay.
will come in. Because if, like we said earlier, a good amount and baby is moving, exercising, throwing the legs out and there, this are very small, and baby is curled in this particular position for a very long time. They may have talipes, they may have constrictions.
What's the first word? They may have what?
Talipes.
So which one is that?
It's where the feet or the fingers are unable to move.
Okay.
And then they get stick to each other.
Okay.
Some are congenital, but it can also be as a result of less amount of fluid in there. And then also with this, the cord gets compressed. And like I said earlier, if the cord that provides oxygen to the baby is compressed, of course, baby will go into distress. And when that is not picked up early, you may lose the baby in there or get a stillbirth.
Okay.
So oligohydramnios is something we don't joke with. That is why at a point in your pregnancy, they request for scan, not for anything or it's for your own good, to really know that the stage or the weeks you are, the amniotic fluid that is around the baby is enough.
Okay.
Right. Okay. And then the next major complication is with amniotic fluid is the polyhydramnios. The polyhydramnios is the excessive fluid, and is about 1% of pregnancy, and people who usually have diabetes in pregnancy have that complication. Excess water in it. And now excess is now going to cause baby to overswim and swim and sometimes.
But that's not bad. Is it bad in itself?
Yes, it becomes a problem because sometimes it overstretches the uterus, and what it's going to do is to cause placenta abruption.
Okay, cut it off from attaching.
So exactly, cause overstretching, excessive the fluid in there, causing overstretching, and baby overswimming. Sometimes they can swim and then the cord go around your neck, cord around neck, and then if there is several knots of the cord, compression comes in again, and then distress might set in. So both sides have effect on the baby and have effects on the mother. Some of the complications with the mothers that they don't like when the abdomen overstretched, and now
that's when there's excess water. The stretch
marks. All what we call the striatum gravidarum all over.
Okay.
And it makes them uncomfortable that complications. So it's very important that when this is antenatally, it will be picked up. Okay. If you honor your review date, you do your scan, of which people don't come to antenatal because maybe they don't have money to do the scan. But my point is that if you don't do the scan for us to pick this poly or oligohydramnios, and you come in a state where you are abrupting and you need to rush you to the theater, because another risk that may lead you in the polyhydramnios is to go in section. In the oligohydramnios, you come and your baby is in distress and you have not dilated. You can't labor. We need to go in and section. You would have to spend more than maybe the amounts you would use to do the scan for us to pick it up and even put you or start managing you before it gets to a very severe state. So it's very important that the antenatal, it boils down to the antenatal care, that when you are able to, you don't go every day.
Once a week. Once a month. It's once a month. Yeah.
Yes, once a month. At least you should prepare for. And it's not all the month that you attend that a scan is being requested for. Yeah. It depends on the weeks that you've gotten to. My hit is that the point where you are asked to do the scan, try hard to do, because we look out this key things, the amniotic fluid, the oligohydramnios can give malpresentation like breech, because just he's all over the place. So if we are able to pick that up, it comes with a good management and it ends well with the pregnancy.
Okay. Does either of them happen for single pregnancies or for multiple pregnancy?
Yeah, yes, with you get with the oligo happening with single, I mean the fetus being one.
Yeah.
And poly, you're likely to get with twin gestation. It can happen with twin gestation. And you can get poly with a mother with diabetic in pregnancy. Either already known diabetic who already got pregnant, or the condition came as a result of the pregnancy. They can also get polyhydramnios. So you see them, you think it's twin gestation, but it's just singleton, or it's just one, and it's just amniotic fluid all over. So we look out for, and with this, your health provider would want to probe further and make sure that you having a polyhydramnios. Let's do other anomaly scans to make sure that baby is not coming out with some abnormality that will affect the baby. And then also measures are put in place on the care that is given to you, so that you don't abrupt, baby don't go into distress. Some points they may even admit you early to monitor you throughout the pregnancy. So it's very important that the underlying is getting the scan done. It's being picked up, because that's our source of diagnosis. Is the even when you come and your abdomen looks big and the midwife is not too sure, you person writes a scan for you to do. It's the scan that will tell us that the amniotic fluid around the baby is too small. The amniotic fluid around the baby is too much. What do we do? Your doctor will take that decision, and then you'll be managed accordingly.
Okay. Well, it's just 10 minutes on top of that. I have here Rachel Hesemati. We are discussing complications of the amniotic fluid. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. Phone lines have been open. Number to call is 0540 130 684 0540 130 684. So I can also drop a question on our Facebook page, Cradle To Crayon Facebook, and also Sunny FM, Sunny TV Facebook page. My guest is here to answer you. Rachel, I want to find out, so what causes this? Because ideally should be 800 mils towards doing at a particular time, but what will make it less, and what would also make it too much?
Like the diabetes, particularly for
the
that,
polygo,
because of the condition, excess is being produced. Now with the oligo, some really are unexplained, because how it's being formed is when the body starts to form it, baby also pees to increase the fluid. So if the baby may be having a congenital problem of the urinary tracts, digestive, and is unable to produce urine, because as you grow and you are developing, you should be able to produce urine, and that also contributes to the amount of the fluid. So if that is not happening, that is why your obstetrician would want to go further and see whether there is an abnormality at the very early stage, to see if that problem is there, and that is affecting to the amount we are getting. And then if it's excess, we want to do a medical check on the mother, that is there underlying conditions that is making, like the diabetes underlying, that is making it produce. Some people did the diabetic condition is not picked up early, but the moment we see excess fluid, we probe further to do other investigations to find out, then is a diabetes. Quickly you are being put on some medications to control it, so that we avoid some of the complications like cord prolapse. Cord prolapse, basically when you have polyhydramnios, end up coming, all the presentation we are looking for is the head to present, but this time around your excess fluid,
that's at the point of delivery.
As at the point of delivery, your cord leads the presentation. It comes first out. And that one is an emergency, because if we don't tackle it from that point of emergency, your cord will go into spasm. What I mean by spasm is compresses, and oxygen delivery is deprived from the baby. Baby goes into distress, and then we may either lose the baby, or baby may come out. I have to say this before. Baby will come out severely asphyxiated, or you lose baby, because when you lose the baby cannot come out severely asphyxiated. So baby come out either severely asphyxiated and may need resuscitation. If you don't have a good team that is able to provide resuscitation within timelines, you are likely to lose the baby. So it's very, very important. And then some common complication they also face is the preterm delivery. Now the overstretch of it sometimes can cause you to lose the mucus plug, and then you go into labor when you are not tame.
You're not tame.
You are not tame. It's also another complication we can look at. I've already talked about the abruptio, where your placenta starts to separate. It's dangerous.
It means there's nothing connecting you to the baby.
To the baby. So when it starts detaching, baby mother life is at risk because you're going to bleed. Baby is at high risk because oxygen is deprived, and we don't get you to theater immediately, you may lose the baby. So it's very important that people, the way they care about buying stuff for the baby, the whole pregnancy thing,
the excitement, getting ready and all that.
When you go to your sonographer or your midwife, your doctor, ask the amniotic fluid around my baby, is it okay?
In fact, nobody will ask this question.
Yes, we
nobody
don't.
will.
Most of the time, is my baby okay? Is my baby happy?
But is it a common case?
Well, lately we are getting.
You are getting a few of them.
Yeah, a few of them, but
Okay.
as in most cases, it's hard to come by.
Okay.
But it's there.
It's
It's just adapt to ask your obstetrician. The amniotic fluid, even if you can still say amniotic fluid, don't worry yourself. The water around my baby.
Headache goes.
The water around the baby, please, is it okay?
Is it okay?
Just like you are concerned, is that the moment you hear the heartbeat, but you are okay. The same way you should ask that. And I'm also pushing that women, when you go to your midwife, ask questions, especially those who can read. Maybe you've read somewhere about placenta abruptio and you ask the fluid. They tell you that, okay, the fluid is okay. Then you can even further ask where my placenta is situated or where it is. Is it okay? You see, it's just good to ask and know. So when I meet such people, yes, then the confidence comes to explain more to them. Tell them about the fluid. Tell them about the position of the baby, of the placenta, what they should expect within this week. People have the apps that they expect, but when they come to you and they hear from you, it adapts or it gives a concrete confirmation of whatever they are reading, and then they are good to go throughout the period of pregnancy. It's a beautiful journey, and we are just enjoying part of it. We should enjoy the full package in asking all our questions when it comes. Usually, we do the scan, the results. We don't even talk to the sonographer. We come to the midwife.
We come back to the midwife.
The doctor opens it. Okay, this is fine. That's fine, and that's it. We are good to go.
All that you want to hear is, baby is fine.
Baby is fine. No, you should know that. Okay, the amniotic fluid is okay. It's not less. It's not more. And what is happening? It's just good to find out more than what we normally do.
Okay. Now, how do you manage this whole issue?
Well, so when it's less, usually it depends on the amount. Okay. If it's very low, they may want to end the pregnancy. End it.
Deliver the preterm.
And rather care for the baby.
You see, somebody who has no way they can give you something to get more of the fluid in you.
No. They'll restrict you.
Because when the baby is not, baby is less than 20 weeks.
Oh, we usually, if it's very extreme within that period, it expels by itself.
Okay.
Yes.
Okay.
But maybe me 32, 34, 35.
He's almost ready to come out.
They will just want to end and then give attention or a care to the baby at the neonatal intensive care unit, so that we have baby safe, we have mother safe also as well. Safe. And with the polyhydramnios, usually some when they come and it's not picked up early, they come into labor, we just ready for any complications that may come up with the baby's resuscitation and the baby's breathing and all that. Yes, if it happens that as a breech presentation, then our plan for the delivery is also changing. Looking at the mother, is he a first-time mother? Has she delivered before? Looking at the weight of the baby, can she deliver via breech if it is breech presentation? All these decisions come in play when it's been picked up early, and then the best care has been given to you.
It's just a minute more to go. Your final words. I mean, how do you? Is it something that can actually prevent?
With the diabetes, if you know you are diabetic or it's been picked up, take your medication seriously, and don't hide.
But it's not every diabetic issue that ends up in the poly.
no, but the point is, some people when they come for antenatal during the history taking, they feel if it's had happened in the family before, doesn't mean it will happen to me, so they don't give accurate information. Okay, but it's good to give accurate information, especially when it comes to pregnancy, because based on the information, the care is being rendered. So when you come, give accurate information so that whatever decision will be made can be done in your interest and the interest of the baby. Go for antenatal, do your scan, ask questions, and you are good to go.
Thank you. Do your scans and you are good to go. Thank you so much for those who listen, those who watch that on TV and also on our Facebook pages. Don't forget, same time tomorrow morning, 9:30 will be a repeat broadcast on Sunny TV. Have a good weekend and enjoy your weekend. Bye-bye.
My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned.